Thank you, Milwaukee County Dems, for hosting this evening's forum on healthcare. I am Paulette Garin, Wisconsin Coordinator for the Leadership Conference for Guaranteed Healthcare. The Leadership Conference is an independent, nonpartisan, voluntary collaboration of over 70 organizations nationwide, including doctors, nurses, labor, and faith organizations, working to mobilize massive support for passage of House Resolution 676, the United States National Health Care Act, which is single-payer health care for every American. If you haven't received the information that's been circulating around the room, or if you didn't get my business card with my contact information, please see me afterwards, and I will be more than happy to oblige you in that way. As a 2008 Democratic candidate for Congress in Wisconsin's 1st congressional district, just south of here, health care reform was the #1 issue on my platform, and House Resolution 676 was the health care plan I supported throughout my entire campaign. I need look no further than my congressional district to see the devastating impact that our current mix of employer-provided and restrictive private health insurance plans have produced. The recent closings of the General Motor plant in Janesville, the probable close of the Chrysler plant in Kenosha, and the hundreds of other jobs lost across my congressional district mean that thousands of people will soon lose or have already lost access to their employer-provided health care. And good luck trying to apply for or afford a private health insurance plan once you lose your employer-provided plan. I'm self-employed, and as a self-employed individual paying for a private plan, I have seen my insurance premiums skyrocket, increasing 30% as of the 1st of this year alone. I currently pay almost $8,000 a year in premiums just for myself and carry a $2,000 deductible. Last week, I received a notice from my insurance company, I have it on the table if you need to look at it for verification, that my premium would again increase as of July 1st. The only solution offered to me was increase my deductible to $7,500.
Oh my God.
Critics of a single-payer system claim that health care will be rationed under a national plan. We already have rationed health care in this country. It's called lose your job and your employer-provided health care and be unable to afford an outrageously priced private plan. Nationwide, 14,000 Americans are losing their employer-provided health care every day. This is over and above the well-publicized 45 million uninsured that we always hear about. These are new cases each day. We are the only industrialized nation that does not have national health care. I heard on the radio yesterday that due to the economy, publicly funded healthcare institutions such as county hospitals are seeing dramatic increases in the number of people they treat. Officials are already expressing concern that the quality and quantity of care will diminish because of the great demand. Yet another example of how healthcare is being rationed in an indirect way. Healthcare reform is the only real economic stimulus we have. The #1 factor affecting American businesses' ability to meet their bottom line and remain competitive in a global economy is exorbitant health care costs. President Obama said if he were building a healthcare system from scratch, a single-payer system would be the best approach. However, he has also said that the nation has a tradition of employer-based health care using private insurance companies, that a lot of people are satisfied with it, and that the goal is to improve the current system. Okay, I'm almost out of time here. I just want to say that congressional leaders have said a single-payer plan is politically impractical, and that translation to me is that it's politically impractical because they receive PAC contributions from Big Pharma and the insurance industry.